Welcome back, class. Section 2 of our guest lectures here with Sherry, and we're going to talk today about evidence-based practice. Now, while Sherry didn't go to KU, one thing Sherry and I have in common is that we are not new to practice. And actually, when we were in graduate school, evidence-based practice
No.
didn't even exist.
No.
It wasn't something we were ever taught. It wasn't even a concept or a notion.
Yeah.
So we've been there since its evolution and sort of its launch into social work. What do you think about it? How do you think it's impacted your practice and our practice as a whole?
Well, I think it certainly has not forced us, has really made us more aware as clinicians that we have to have some reason for providing the interventions we provide to our clients, that we're just not making choices a little bit haphazardly. But and it's also what most professionals, whether it be medicine or mental health, it's the language of today's professional world. So, although we talk about the fact that we didn't really have evidence-based practice discussions I was in school in the early 90s. I actually had a practice teacher and I've heard you talk, Gray, about really even as clinicians, how we day to day in our sessions with our clients can do some measurement of whether or not we're being successful in what we do. And so that was introduced. So when we started to hear more about evidence-based practice, I did reflect on that professor of mine who really forced us to start thinking about whether or not what we provide to our clients is effective. So today we live in a world where we really do need to do the research. So when we're working with different populations, for myself, I've worked mostly with adults. I've worked mostly in an EAP and in psychiatric settings. So, we know that cognitive behavioral therapies might work best with depression and anxiety. And so as students or as clinicians, I think it's important for us to use what we have available to us. We can do so much research just by using the internet to, find out what's current in practice, what research shows what is most effective in working with our clients and the different populations we serve.
As a clinical supervisor, as a practice teacher, and we're introducing theory to practice and why research is important, I think as a clinical supervisor, the next step is to make sure that your clinician is able to connect that theory to practice. And that's part of that evidence-based notion that you're right, we're not just pulling something out of our back pocket and winging it, that you really are grounded in what you're doing. When you go to get your gallbladder removed, they don't just, flip a coin and remove it out of your armpit. There's a very specific path that they take to remove your gallbladder. So
very true.
I do think that has become really important. Where do you see it going in the next 20 years as you and I, retire?
I would think that we're going to continue to, because of the world we live in, we'll continue to emphasize that whatever work we do with clients has some evidence, has some success. But I also hope that we learn to finesse that, in the sense that we still can use our creativity in working with people and bring it to our own skill set and be authentic in how we work. And I think sometimes working with supervisees, they get really stuck in just trying to practice those interventions, but not always, feeling comfortable yet. So, but one of the things we always talk about in clinical supervision is, before you finish, know what theoretical frameworks you're drawing from to work with the client populations you work with. And we talk about it in supervision and we give examples. But I would also think that as we change and move and go to other different settings, we have to continue to work and strive to get different skill sets.
Right. I like to say adding tools to our toolkit, because as you mentioned, cognitive behavioral therapy, it's not like for everybody.
Right.
So you can't just take every client and plug it into the same formula, which is where we have that ability to express our creativity. So the more tools you have in your toolkit, the better you're equipped to deal with a variety
right.
of clients. So,
Right, right.
all right. Well, thank you, Sherry. I appreciate it. Hey, class. Welcome back. Next section, section 2, we're going to talk about evidence-based practice. So you obviously heard that 100, maybe to 200 times a semester while you're in graduate school, evidence-based practice, practice based on evidence. What does that mean to you now that you're out of school and you're practicing?
It means that evidence-based practices is not so much as going off of experience, but competence, which is in our code of ethics. And like I kind of focus on competence when it comes to that, because experience, you can have 9 years of experience in doing a crappy job of whether implementing or even the research that you are using to, or the theories that you're using. But evidence-based practices allows us to be able to see how practices are used and how effective they are to ensure that they continue to be effective. Because although although the theory may stay the same, people will change, so you have to remain competent. So I always utilize evidence-based practices for everything that I do to ensure that I remain competent in the work that I do.
Yeah, I think that's really important. And part of being competent is also knowing what you're not competent in.
Right.
Because you can't be competent in all things, right?
Right.
Like my students know that I'm not a substance abuse guy. Don't ever want to be one, never going to be one. And when I run into that as a client issue, I know to get somebody that's competent in that, in that area, because that is really important. So, what kind of competencies are you developing, a couple of years out of school at this point?
Competencies I'm developing right now. I try to I utilize trans-theoretical model a lot in what I'm trying to implement when it comes to addressing families like at Children's Mercy. Actually, in everything that I do, I look at the trans-theoretical model as far as going through the stages of change. I use that as a basis to be able to see where people are at, meet them where they're at, and as a foundation for whomever I'm working with. I don't know. Some of the competencies that I really work on is motivation for change. So that would be like motivational interviewing is a big component of my competency. But I use those two as a foundation for my work with the Board of Education, my work with my Black Mental Health Initiative, also with my work here, to be able to meet people where they're at.
Absolutely.
And be able to kind of assist them with creating some self-talk in regards to change, because the majority of issues that I'm addressing, whether it's through resources or support, is ensuring that they're motivated for the change that those resources and support may provide for them. So yeah.
Absolutely. Well, thank you, Cecil. Appreciate it.
Yeah, no problem.
Welcome back, class. We're here with Liz, and we're going to talk about evidence-based practice. It is a big component of social work practice. So what does that mean to you as a clinician, evidence-based practice?
I think it's having an idea of what the research says, being able to look at the population you're working with and what kinds of therapy or what modality works best with that population, with the need that the family has, and then being able to apply it and tweak it as needed with whoever you're working with.
I know a lot of students cringe when they think about research, but without research, we can't connect the right modality to the right client. And so connecting research to practice is pretty important. And so I think I love that you touched on that, because I do think that is important. So also I think it lends to competencies. having evidence-based training. We're going to talk in the next section about your toolkit, but how many different evidence-based practice models are you trained in, just out of curiosity?
So I was able to do just general CBT in grad school, and looking at how to apply that with any sort of diagnosis, depression to eating disorders to substance use. And then I also have training in trauma-focused CBT and EMDR, and then I've had some short seminars and day-long trainings in like DBT, motivational interviewing, and then some family and couples therapy work.
Okay, all right, thank you. Thanks. Hey class, welcome back. We're here with Andrea at Creative Connections. We're going to talk about evidence-based practice. So some students can be unsure about, what tools to put in their toolkit. Andrea went out and put, I'm going to exaggerate, 100 different tools in her toolkit, and then I'd say to her, but then how do you know which ones to work on and use that? It's an exaggeration. She didn't really do 100. But what does evidence-based practice mean to you, and what evidence-based tools are you trained in?
Yeah, so evidence-based practice to me means that these are things and tools that work. These are things that have been proven to be effective with a large amount of people, and even with different individualized activities and things that you can do. It's just these are the most effective for each person.
And you're trained in what tools?
I'm trained in EMDR, level 1, TFCBT, which is trauma-focused cognitive behavioral therapy, and then EMDR is eye motor desensitization reprocessing, TheraPlay, level 1, which is attachment work for littles and all the way up, and then also OpPlay, which is autism, kind of play therapy, and then I'm also a registered play therapist.
Okay, so I think $1 million question, how do you know which tool to use with which client?
Well, you really don't. You just kind of see which ones that you think that would work the best for them, and you try it. You try it out, and you test it, and if you feel like they're getting a benefit from that, or they got some type of aha moment or insight, or learning a new skill, or they're like, wow, I didn't think about it in that way, then that's when you know, okay, maybe these types of tools might be helpful.
Right. And I know from our conversations that there isn't one modality that fits all clients. And the benefit of having, quite a few tools in your toolkit, think, classmates, about your own learning journey. Not everyone learns the same way. Some people learn by reading, some people learn by listening, and I always joke that's not really my strength. Some people learn by talking, some people learn by doing. And some people, probably most people, learn by a variety of ways. And having that much variety in your evidence-based toolkit, I think you're able to, once you form that engagement and that alliance and figure out what's best for the client, then you can move through that. Does that make sense to you?
Yes, I use I'll use a little bit of play therapy, and then I'll switch to some EMDR, or I'll add in some TheraPlay. So I'm using all these modalities within 1 hour. So I'm always shifting and moving with whatever the client
Right, because not every client is going to present the same way
No.
or have the same lens. So, all right. Well, thank you. Appreciate that. Thanks, class. Hey, class. Welcome back here at A Balanced Mind Private Practice with Amy. So we're going to talk in this segment about best practice and evidence-based practice. Why is that important to your work, to work from a position of best practice and evidence-based practice?
Well, evidence-based practice is best practice because it protects the client from getting hurt. Not only does it protect the client from getting hurt from the decisions that I'm making, it actually protects me from being incompetent. I guess you could say.
I think that is a perfect answer. It does both protect the client and protect us. You're absolutely right. Rather than pulling some treatment nonsense out of your back pocket, right?
Right.
And then the client gets hurt, and then you say, well, look, I'm a licensed clinician, but then was that treatment proven to be effective or not, or did you just make it up? So you're absolutely right. It protects the client and protects us. So why is it important to protect ourselves?
You're gonna have to pause.
I'm gonna have to pause.
Why is it important to protect ourselves?
Yeah.
I think protecting ourselves is a part of self-care. Self-care is important when we protect ourselves.
Right. And self-care isn't just working out 3 days a week, or in my case, 0 days a week, or eating right or sleeping right. Also, the best practice is a form of self-care. That way we are less likely to hurt a client, less likely to end up in trouble ourselves.
Right.
So we didn't need to pause at all. You did that perfectly. So, by the way, Amy is really nervous, and she's really angry at me for even shooting the video, but she'll be fine. So, all right. Thanks, Amy.
Thank you.
So, hey class, welcome back. We're going to talk with Stacy about evidence-based practice. Great segue at the end of the last segment when she talked about this next year, 2020, maybe getting trained in EMDR, which is an evidence-based practice. Aside from that, why is it important for the social worker to understand evidence-based practice?
I mean, number one, it's foundational to our differentiating ourselves as a professional versus someone who is, maybe they help people, but they don't have anything that they're standing on to do it. And so somebody may call that, and they may be called a fraud, even if what they're doing is appropriate, safe. Maybe it could be an evidence-based practice. Maybe they do or don't have a degree. But if someone knows that you have you're a degreed professional, you have a license, and you use practices that have science behind them, I think it comes down to people putting their faith into us. I really think it, and that's also part of the therapeutic relationship, is the faith and trust that's put into somebody.
Yeah. I would completely agree that it improves our credibility and our competence, which improves our alliance. Now, the research from Scott Miller, he's a psychologist in Chicago that I like quite a bit. He and another psychologist from Florida named Barry Duncan did research. One of the things they found is that it doesn't matter which modality, which evidence-based model you use, they're all about the same level of effectiveness. The part that is key, right, that is the most significant is that alliance, the part you were just talking about, forming that trusting relationship with the client. The client trusts that what you're doing is credible and that you are competent. And so operating and practicing out of best practices, I think, ensures that, to improve that alliance. That's where the significance occurs. It's that alliance. It's not whether you do CBT or DBT or anything that ends in T. It has a D. So
or EMDR.
Yeah.
But I think the other thing is, the other two things I think is one, we have that ethic, so that internally it improves the alliance and the trusting relationship. But internally for ourselves as a professional, we have that ethical responsibility
Right.
to our clients individually and on the whole to do the best work for and with them that we can. So number one, that is using evidence-based practices. But number two, I think it's having that competence and education to choose the appropriate way of helping that individual with the particular issue or thing that they bring to us.
Yeah, absolutely.
So it's kind of a combination of those things. Is that we have the education and competence. We also have the understanding that we need to start where the client is to pick the appropriate piece to help them with, and that if that doesn't work, to go on to the next appropriate piece.
Absolutely. Well, thank you for this segment, Stacy. I really appreciate it. And we're going to sign off here, and then we'll sign back on for the next segment. So thank you.
Thanks, guys.
Hey class, welcome back. We're here with Lindy at Avila University for our second segment on evidence-based practice. So as she and I were discussing right before I turned on the camera, that didn't exist when we were in graduate school, but certainly we've seen the development of evidence-based practice and the validity, and I don't think a week goes by as a teacher I don't make a reference to it.
Right.
So what are your thoughts about evidence-based practice, its development, its birth, and kind of where we're at right now?
Yeah, I think that when I was in grad school, which was in the 80s, it was sort of a different era in terms of being more of a modern era. And so social work was using other fields. We used a lot of psychology and a lot of other fields who had done the research on their methods. And I think as the 80s and 90s approached, we got into that postmodern era, then evidence practice suddenly came around, which I always had a little bit of trouble with, because it was like we're teaching students about constructivism and, you know, some different subjective truths, and yet our field's starting to really try to prove things as empirically proven.
Right.
So, so really our, you know, accrediting body kind of pushed our program into getting better as a social work program about really building in evidence that we were teaching well. And that was kind of my first introduction with that. I'd certainly done assessment at my agency, but it was more client feedback forms and recidivism, really pretty straightforward stuff. So I think, you know, we started out, so that's kind of how I was teaching by the time it got pretty popular. CSWE now has us do evidence-informed practice, and I like that better because it includes practitioner wisdom and client wisdom in the sense of collaboration as well as empirically based studies. And I think that trio is really important, because otherwise it's hard not to be in this expert position. If you have this theory base and you're telling your client, you know, or you're directing what's going on, then we lose all the postmodern greatness of empowering and strengths focus and things like that. So that's kind of where I am. I really have included a lot more assignments for my students to ground themselves in some kind of theory or concept or something. So they're not just flying
sort
by
of,
the seat of
that's
their
right,
pants.
sort of build their foundation. I feel the same way. As an adjunct at UMKC, I had a student one time raise her hand in class, and I was teaching advanced practice, and I said to her, "Yeah, what's going on?" And she said, "She goes, I got to be honest with you, Gray. You know, you talk constantly about connecting theory to practice, and that's part of the grounding of evidence-based practice. Yet my field instructor said, out in the real world, we don't do that. That's just school talk."
Yeah.
And I went, "Oh,"
Yeah.
made me a little bit worried about her field instructor.
Yeah.
Because really, I agree with you. If every student grabbed one or two theories that fits their lens,
Mm-hmm.
that'll help develop them, and they won't feel like they're flying around with their pants on fire.
Absolutely. And I think,
And clients are better for that.
yeah. I mean, I always use the analogy, if I'm going to have brain surgery, I don't want to say to my neurologist, you know, how'd you figure out the brain? And he says, well, I work on my car every weekend. You know, I want to really be able to sort through that. Is that someone I'm going to trust? And I think it's part of why we get dinged as a field, is we're not as credible at tying things. And we use such a broad base of theory. So it's more difficult. It's a discipline. You know, honestly, I didn't do it as much as a practitioner as I did once I became a teacher. And it isn't that easy to do. But when I was in practice and I would hire people, one of my questions was, well, what's your lens? How do you look at cases and clients? And almost without fail, people would say, I'm eclectic.
Eclectic, yeah.
And it'd be like,
absolutely.
okay, well, tell me a couple theories or concepts that you have in your tool basket then of eclecticism. And it was a rare person that could do that, tie it back. And if they did, and then I went on to say, what's the theorist or who primarily developed that, they couldn't do that. And so I always tell my students, you are not going to be one of those people in an interview. I want you to be able, it doesn't mean you have to, embrace that theory fully, but I want you to tie things back, whether it's, just an interview technique you use or whatever, so that your eclectic basket really means something.
Right.
It's not just a wide open thing.
The commercial that's on TV right now, where the theme is it's not okay just to be okay. I think it's a Geico commercial,
Mhm.
and the guy's getting ready to have surgery, and the surgeon comes in. I didn't want to be that social worker that was just okay. I
That's
wanted to be the best for my client for that moment.
Yeah.
And I really want my students to be the best for their clients.
Absolutely.
And it doesn't mean they have to know all of the theories, but they've got to, like you say, pick one or two and ground themselves in that.
Yeah.
I don't think that that's that difficult to do.
It really isn't. And it kind of validates what they may intuitively know already or are experiencing.
Absolutely.
That it says, oh, I am doing something that somebody has looked at and said this is valid, like relationship stuff. I use that one. When the research is hard, that the relationship between the client and the worker is one of the key things for change. To me, that's a relief as a social worker.
Right,
It's like
right.
if I can build that trust and that relationship, then I'm doing probably about 60% of the work right there.
Absolutely.
And it takes some of that responsibility off your shoulders.
Absolutely. The key thing, it is one of my trick questions, right? The alliance, forming that alliance is
Yeah.
the most important thing. So,
Yeah.
well, thank you so much,
You're
Lindy. I
welcome.
appreciate it. Thanks, class. Hey, class, welcome back. We're here with Tomas and Athena, and we're going to talk a little bit about best practice, evidence-based practice. In both of you have two very different jobs, but at the VA in working in job readiness where you're at now, and class, for what it's worth, she was in HUD-VASH for 15 years doing long-term housing, but now is currently doing job readiness. Why is best practice and evidence-based practice important for you and the veterans that you serve?
I think it's very important because a lot of times back in the day, social workers use eclectic approach. What worked best for
A little bit here, a little bit there.
yeah. But and I thought I can't knock that because it was good in that day and it did work in that day. But I think that as time progressed, we needed something that we knew that was tried and true, so to speak. So I think evidence-based practice is good. The approach is good. My favorite is cognitive processing therapy, the way you process what you think. And a lot of times you get stuck in what you think. And I think that it works, is good, but is it the end all, the be all, end all? No, I don't believe that. I still think that because you cannot predict human behavior, I think that as you move forward with a person, that you have to be aware of what it is that they may need to help push them forward. And evidence-based does work, and using that does work for a lot of people, but for some people it does not work.
That's right. What about you in your work, Tomas? Why is it important to you to use evidence-based and best practice?
Well, I think, obviously it can be effective, similar to CBT, cognitive behavioral therapy. It does have some pros to it. It doesn't work for everybody, as Athena says, but it's got a lot of useful tools that I can use and help others. And I've just learned, obviously evidence practice is, research driven and which is important. But I've also learned that it's, you have to meet the client where they're at for you to be effective. So
Right, absolutely.
It's a combination of both.
And that's hard. I recently read something in the Star, and I thought it was really appropriate. And it was talking about the biases in child welfare, and that is, a worker goes into a house, a dirty house, and all they see is the dirty house. What they don't see is the love and the bond with the children. And so they get that feeling of, I just need to rescue these kids, not worrying about what's going to happen 10 years from now and 15 years from now. So you're absolutely right, meeting them where they're at, which means you have to be okay with a client who lives in a dirty house. It may not be the way you want to live, but they certainly have that right to want to live that way.
Yes.
So
If all the other pieces are there, you know, you can teach them how to clean up a dirty house, but people without love, you can't really teach them how to love. That has to be the core of who they are.
yeah,
So, yeah.
absolutely. Well, thank you guys. I appreciate it. Thanks, class.